I'm Victor Ross. I'm the director of the Laser and Cosmetic Dermatology Center at Scripps Clinic in San Diego. And I'm here to discuss the raw Pharos excimer laser, which we've had almost 10 years. And we've used it almost exclusively for vitiligo and psoriasis, probably 50-50 mix. And we found it to be a big part of our medical laser therapy program. It certainly helps with vitiligo, particularly on the face. Off the face, a bit more challenging, like all vitiligo cases off the face. But we've had one particular patient who I can recall where she was a sports person, a young lady with type 5 to 6 skin, and she was very self-conscious about her knees and elbows because those were areas that were showing when she played sports. And after about 35 treatments over about 5 weeks, we really saw about 70 to 80% repigmentation of the knees in particular, and she was very happy with that, and it really changed her outlook about how she wore her sporting gear and how she participated in sports. It gave her a higher level of confidence, which was very important. And then we have a stable of psoriasis patients who typically use the excimer laser as part of their ongoing medical therapy. So they'll typically use maybe a topical steroid on the weekends, Dovanex or some other products like that during the week, and top that off with the excimer twice a week. So we found it to be very useful. It's very versatile. It's easy to use. Our nurses do the treatments and they find it ergonomically friendly. It's been reliable. So it's a big part of our therapy program at Scripps Clinic.
I'm Rachel Ness. I'm a board certified dermatologist and owner and dermatologist at Pharos Center for Dermatology. I've used the Pharos excimer laser for years. I can't imagine running my practice without it. I use it for tons of psoriasis patients. I use it for also some of our eczema, atopic dermatitis patients, also our vitiligo patients. My patients really appreciate having another option. A lot of my patients with those conditions, whether it be eczema, atopic dermatitis, vitiligo, or psoriasis, come to me looking for another treatment option. They've tried topicals, they've maybe tried oral medications, or they want to stop their oral medications or not go on injectables or internal pills that involve a lot of side effects, so they're just looking for another option.
I'm Dr. Carl Thornfelt. I'm a dermatologist practicing in Fruitland, Idaho. I've been there 35 years and trained at UC San Diego. I've been using this particular device for 13 years. It's been a very good benefit for our practice. It's the only full-time one in Idaho for a number of years. Using this device, we are able to prevent a lot of side effects in our very active population. So I find it extremely helpful, not only in individual resistant plaques that are not responding to topical therapy, or if they have a few lesions in hard to treat areas that, and they have contraindications for certain systemic therapies, I give this as an option to patients.
Hello, I'm Dr. Christopher Zachary. I'm Professor and Chair, Department of Dermatology at the University of California, Irvine. We actually have two Pharos devices from Ra Medical Company, and I have to tell you that they're working all day long. We treat patients with vitiligo, psoriasis, eczema, localized, T-cell lymphoma. Occasionally we'll use it for alopecia areata and various other conditions, and it's a great device.
I originally purchased the Pharos excimer laser for one of my best friends who had new onset vitiligo. Now, much to my pleasant surprise, we're using it on dozens of vitiligo patients, as well as patients with psoriasis and other dermatologic diseases. Thank you, Pharos.